keeping the heartbeat of the city healthy with health tips and benefits from real doctors in the area. This is Health Help.
October is National Breast Cancer Awareness Month. And that brings to mind that breast cancer is the #1 diagnosed cancer in women in the United States outside of skin cancer. Breast cancer is also the second leading cause of death in women in the United States, secondary to lung cancer. The good news is that the incidence of breast cancer has been declining, and women diagnosed with breast cancer are living longer thanks to early diagnosis, detection, and improved treatments. 1 in 8 women will develop breast cancer that is invasive in their lifetime. This gives a woman about a 12% chance of developing invasive breast cancer during her lifetime. Breast cancer treatment is greatly improved since 2000, and treatment options currently include surgical removal of the tumor, radiation, chemotherapy, or a combination of both, and also preventative medicines, which can come in the form of a pill. Most importantly, it is to get better outcomes that women get to the breast cancer early. So women should be doing breast self-examination every month starting at age 18 or forward. Women should definitely get their mammograms, and although the recommendations vary from institution to institution across the United States, the American Cancer Society says that women starting at age 40 should have the option of yearly mammogram, and definitely at age 45, women should begin yearly mammographic screening. And that should continue yearly for life as long as the woman has a life expectancy of 10 years or greater and is in reasonable health. Women who are doing breast self-exam may feel some kind of a discrepancy in the breast, for example, a lump that was not present, and women often will misunderstand that the lump would be painful if it were cancer, but that isn't true. We know that many times cancers are not painful, so a painless lump in the breast, change in the breast tissue, change in nipple discharge is a signal, an alarm signal, that a female should seek additional attention. Also, some women have had painful changes in the breast, and then there was breast cancer determined. So it's important that women see a provider for breast examination for any change in the breast, whether it's a painful change or a non-painful change. Early detection by breast self-examination and mammography will lead to improved outcomes. The earlier a female can find cancer, the better her likelihood of responding to treatment and having an increased potential for cure. Risk factors for breast cancer include female sex. Women are at greatest risk for breast cancer. However, men can develop breast cancer, and if they detect an abnormality in breast tissue, should see their medical provider. Age is also a risk factor for breast cancer. Women over the age of 55 years have an increased incidence of developing breast cancer. Patients with a family history of breast cancer are at increased risk, and patients with a genetic mutation, particularly the BRCA1 or BRCA2 mutation, are at increased risk for breast cancer. Although genetic mutations account for only 5 to 10% of breast cancers, a female's risk is greatly increased. If you have a family history of breast cancer or feel you are at increased risk for a genetic mutation, you can contact the Wellmont Cancer Institute, and we do have genetic counseling services available. Additional risk factors for breast cancer include Caucasian sex. Women who are Caucasian have a slight increased risk in breast cancer over African American females. However, African American females do die more often of breast cancer. If you have a personal history of breast cancer, a history of dense breast, you are also at increased risk for breast cancer. Patients who are obese, related to inactivity or otherwise, can also be at slightly increased risk for breast cancer. Your doctor and the American Cancer Society recommend that you stay physically active with a moderate amount of exercise most days of the week. Alcohol has also been linked to breast cancer. It's recommended for females that they do not consume over 1 alcoholic drink per day, as more than 2 drinks per day can increase your risk of breast cancer slightly. Obesity is also a risk factor for breast cancer. Premenopausal women make estrogen in the ovaries. After menopause, estrogen is made from fat tissues, so having an excess amount of fat can increase a female's risk for breast cancer. Breast self-examination in combination with mammography are important tools to help women diagnose breast cancer earlier. Wellmont Cancer Center is fully equipped with advanced breast imaging, which enables providers to find tumors earlier, and earlier detection of breast cancer improves outcomes for women.